Hi, in this video, I'm going to be demonstrating how to document on a progress note. This video is going to be conducted in a test environment, so please note some of the items might be different than what you see in your production environment. Let's get started. I'm currently on my office visit screen, and I'm going to be playing the role as a medical assistant throughout this demonstration. I'm going to be using the patient test Samantha. Notice in parentheses, I have Sam. That lets me know that this is my patient's preferred name. I can see that my patient status is marked as arrived, so I know that they're ready for me. I'm going to go in and update the room number, so my patient's going to be in room 6, and then I'm going to change my status to nurse. I'm now going to click directly on my patient's name, and this is going to launch my progress note. At the top, I have what's called my patient dashboard, and then on the right-hand side, I have my right chart panel. Now, currently, my right chart panel is blank because this is a completely new patient to my database. As I start filling things out, such as medications and histories, etc., they're all going to automatically populate over here on my right chart panel. So we'll come back and take a visit at this later. I want to point out in this blue bar, my patient's name and birthday listed here again. And then all the way on the right hand side, I can see the status and as well as my room number. Now my progress note is made up of a SOAP note. In order to access the window, I'm going to click directly on the orange link. So the first one we're going to go to is our chief complaint. Notice I do already have something listed here on my chief complaint. That's because whomever scheduled my appointment, the reason that they put in automatically flows over here. Now, before diving into the chief complaint, I want to point out what's called a floating toolbar over here on this left-hand side. The very first icon that you have is going to represent the screen that you are currently on. Your next icon, schedule, this is going to allow you to schedule an appointment for your patient if you need to. So it's going to take you to your resource schedule. The next icon is your documents. If your patient had anything scanned into their chart, you'd be able to see it from here. The next icon is your treatment timeline. So this is going to show you moving forward all treatment that has been done for your patient. You'll be able to see what assessments were used, any treatment notes, medications ordered, labs ordered, diagnostic imaging, procedures, immunizations, injections, as well as referrals. You have an icon for your labs. So any labs that have been ordered for your patient would be shown here. And then in the top right hand corner, you can always toggle over to your diagnostic imaging or procedures. If you utilize Prisma, you can access it from right here. You have your RX icon that's going to show you any medications your patient is on. And then if you utilize Eva, you can also access that from here as well. The last icon that you have is your settings gear icon where you can rearrange the order of your floating toolbar if you would like. I'm going to click back on my chief complaint at the very top to take me back to this window. Now, as mentioned, I do already have something listed here. Again, that pulls from the reason of what was scheduled for my appointment. And I have a couple different ways that I can elaborate here. I can use my keyword up at the top. I can begin searching for something, and it's going to just add it in the next line for me. Or I could simply free text here, whatever my preference is. Anywhere you see a trash can icon in ECW, it's going to allow you to delete that particular item. Now notice here in the top right hand corner, I have transition of care and there's a green check mark next to it. That lets me know that my front office has already taken care of that for me since this is a new patient visit. Instead of closing in and out of the windows to get to my next section, I'm going to use these shortcuts down here at the bottom right hand corner, and it's going to take me to the next window. So in this instance, I'm going to go over to my med reconciliation. In the top left-hand corner, I have the option to search for a medication. Before doing so, I'm going to click on my filter icon and just make sure that I have the appropriate section selected. Underneath my RX type, I'm going to make sure that I have it under Medispan RX so that I'm searching for all the medications in that Medispan database. I have the option to search with contains or under starts with, whatever my preference is. I can also search showing my doses as standard, my favorites, or both combined. Once I have my filter set the way I would like, I can then start typing in my quick search. So I'm going to say my patient is on orthotricycline low. I'm going to select my medication and it's going to bring up the different strengths that are listed in the database. Now, for this example, I only have one strength listed. Notice at the bottom, I have the option to choose the generic equivalent if that applies for my patient. Anytime you see this pencil icon, that's going to allow you to go in and make some edits prior to selecting. You always want to work your screen left to right, changing anything as needed. For this example, I'm satisfied with how it's already written, so I'm just going to click OK at the bottom right, and it's now going to add my medication for me. Now, if I didn't hit my pencil icon first, I can always still click on the medication name, and it's going to bring up that exact same RX edit window that I can work left to right, making changes as needed. Notice on the far right-hand side, I have a T for taking, N for not taking, U for unknown, and D for discontinued. I also have a trash can icon. However, I do not want to delete any medications for my patient. I just want to choose the appropriate status. So, moving forward, when my patient comes back for their follow up visit, I would still have this medication listed and I would just choose the appropriate status that applied. In the top right hand corner where I have this blue bar, I can toggle to different windows. So, I'm currently under my current medication. My next tab is my past RX history. So you can see that the medication I just added in is already listed here. Moving forward, it's going to track all of those medications on this tab. I have my external RX history. Now, due to being in a test database, this window is not going to work. So I just want to elaborate a little bit on it. Based upon your patient's insurance and the pharmacy they have on file, I could go to this external RX history, click my retrieve button, and it's going to show me the different medications that my patient has had filled at that pharmacy with that insurance on file. I could then go in and mark if they were taking, not taking, unknown, or discontinued, and it would automatically bring it over to that current medication tab. The last tab that I have is my unreconciled past meds. So if I was not in my patient's chart choosing the appropriate statuses here for taking, etc., it would then drop that medication under unreconciled meds. Once I have all my medications listed and reconciled, I'm going to hit the verified button up here in this top left hand corner. I'm now going to move in the bottom right hand corner to my next window, which is my past medical history. In the top left-hand corner, I can search using keyword or I can simply free text, whatever my preference is. So I'm going to say my patient has anxiety. And then in the top right-hand corner, I want to mark it as history verified. Notice underneath here, I have this blue arrow. This is going to allow me to expand my window. So if my patient has lots of histories listed, I can just expand it to get a little bit more real estate. I can click on that arrow again and it's going to collapse it back for me. Notice down at the bottom, I have my allergy section here. So this is where I can go and enter in any allergies that my patient has, or if my patient does not have any, on the far right-hand side, I have the option to mark no known drug allergies, and it's going to automatically check my allergies verified box. For this example, I am going to say my patient has some allergies, so I'm going to start searching for them here. For example, if my patient was allergic to amoxicillin, I can start typing it in and it's going to filter it for me here. I can make the appropriate selection, and then I have some different options over here. Now, these fields aren't mandatory. However, I do want to go ahead and fill these out if my patient provides it with me. Once I add that medication in, it's going to drop down here at the bottom. Now, I can also enter in other things such as latex. Notice it has this little leaf icon next to it, letting me know that it's a food environmental allergy. And then you have the option to enter in what is called uncoded allergies. So, very important that we understand the difference. Anything that is added in as an uncoded allergy is not going to run through my drug allergy database. Meaning, if my provider prescribes a medication, this allergy that I add in is not going to run through that database to let me know if I have any interactions, whereas these medications will. So let's say my patient is allergic to Meteral Dose Pack, and I don't see the one listed in here. Notice at the very bottom right, I have add uncoded allergy. So this is going to give me the option to add it in manually by myself. Once I click my OK button, I am going to get this U indicator letting me know that it's an uncoded or unstructured allergy, as well as this yellow bar down here at the bottom letting me know that it's not going to run through that drug allergy database. The same thing applies for any custom medications that I might add in here as well. So, very important that we are choosing the appropriate one. For training purposes, I'm going to leave this uncoded one here. I can now click my allergies verified box over here on the right hand side, and I'm ready to navigate at the bottom right to my next page, my OB and GYN history. At the top, I have my GYN history. You'll notice that I have on the far left a denies column. So I can, for example, click in this box and it's going to put an X listed here for me. I also have the H/O, which stands for history of. And then over on the far right hand side, this is my notes section. So anything I want to fill out, for example, if I wanted to fill out something next to periods, I'm going to click directly in that box. On the left hand side, it's going to give me some different options, or I can free text over here, whatever my preference is. Once I fill out all of the appropriate options that my provider prefers, I can then move on to my next section down at the bottom, which is my OB history. The same thing applies here. Directly next to the line, I'm going to click in the blank box and then fill out the appropriate information. Please make sure that you're filling out this information according to what your provider prefers. For example, if your patient does have pregnancies, you want to make sure that next to each pregnancy, you put in that appropriate information. At the bottom right-hand corner, I'm now going to navigate over to my surgical history. Now, if my patient has never had any surgeries, in the top right, I have the option to mark denies past surgical history. However, if they have had any surgeries, I can use that keyword to search or I can simply type them in here. The only difference in this window is I have an additional column where I can enter in the date. This is not mandatory, but if your patient knows the month and the year, you can always add that in here. And then mark it as histories verified in the top right. You can enter in down here at the bottom any hospitalization stays. In this example, I'm just going to put denies and then move on to my next page, which is family history. On the left-hand side, I'm going to have some different family members listed. I can choose the status of that family member. If I know the year of birth, I can enter that in, and it's going to automatically calculate the age for me. I have a few different options listed up here for different histories that my family member might have. Keep in mind that this is a fake test database, so my options are going to be listed different than yours in production. Let's say that my family member does have diabetes. I can simply click in that box and it's going to put a check mark. Notice I also have a cursor listed here. That's going to allow me to enter in the date that my family member was diagnosed, and then it's going to automatically calculate their age for me. Now, let's say that I needed to add something in addition that is not listed here. I can do so by clicking on this notes box. From here, I can select from this different keyword list, or I could have always free text in this middle section, depending on my preference. Once I click the OK button, it's going to add that information in here. And I have this little blue notes box letting me know that something's been added in. Down here at the bottom, I have this notes window, and over on the right-hand side, I have this ellipses. Now, I can click on my ellipses, and I have some different keywords listed here. Yours is going to vary from mine in my test database, but once you select the appropriate one, it's going to say family history negative for breast, colon, and ovarian cancers. I can click my OK button, and that's going to populate down here at the bottom for me. Once I have all the appropriate family histories documented, I can mark this as family history verified up here in the top right. My next window in this bottom right-hand section is my social history. On the left-hand side, I have different categories such as drug and alcohol, and then the different items that are associated. So for example, if I needed to fill out the opioid risk tool, I would be able to do so here. Anytime you see a blue S, that lets you know that it is structured data. I have the option to fill out my tobacco use. Notice again that structured data. So if I wanted to fill this out for my patient, Just as we saw before, I'm going to click on the blank box directly across from it. This is going to open what is called my Smart Form. So I can fill out the appropriate options listed here. And then at the bottom right-hand corner, I have the option to save my form. This is also going to save your form in your patient docs window as well. Once I fill out all the appropriate information here by clicking on those categories on the left-hand side and then completing them over here on the right-hand side. I'll fill out all the appropriate options and then mark it as history verified in the top right-hand corner. Now, the next section I want to go to is my vitals, but notice at the bottom right-hand corner, I don't have my vitals listed here. So instead of closing out of my window, I also have these different icons that run across the very top. I can hover to discover to find out what each one is, and then I can just quickly navigate it from here. This yellow bar is going to represent the date of the current progress note that I'm on, but moving forward, I would see all previous ones listed. I can enter in my patient's height in inches. I can then enter in their weight. It's going to automatically calculate their BMI for me. And based upon the settings in my database, it'll turn red, letting me know if it's out of that normal range. And I want to go in to enter in any other mandatory vitals that my provider wants me to capture. Once I've completed all of my vitals, down here at the bottom under my notes section, I want to enter in my name, my credentials, and if a chaperone was necessary, I can document that here as well. Once I have all of my information filled out in the top right hand corner, I'm going to mark this as vitals taken. I can now hit the X in the top right hand corner of this window and it's going to close out and everything that I just entered is now going to populate on my progress note for me. A couple other things that I might want to add in is, for example, my immunization history. I can always click on immunization up here from this blue bar where I have IMM, and I have the option to enter in add immunization history. So, for example, maybe my patient had a COVID shot previously, and I want to document that in here. On the left hand side, I can select the appropriate immunization, and then over here on the right, I have the option to enter in those historical dates. So let's say my patient had a shot in April 1st of 2021. Once I click my save button, it's going to have that listed here for me. I can also toggle on the left-hand side to therapeutic injections. Click on my add button from here and do the same thing. So on the left-hand side, I have different injections that are listed here. Once I select it, I then have the option to choose therapeutic injection given in the past. I can hit my close button and that is now going to be saved in my patient's chart. So now that we've added in all these different things, I want to circle back to this right chart panel over here. I have some different tabs listed at the top, for example, overview, and it's simply that, an overview of my patient's chart. Underneath each section, I can see if something's been added. So for example, here are the allergies that I just added in, my medications, my immunizations, etc. Your next tab is your encounters. This is going to show you every encounter, whether it was an actual office visit or a telephone encounter that your patient has had. You can use this arrow at the top right to toggle between all of them. Now, my patient was brand new, so they only had one visit, but I can see a preview of that note listed right here. Your next tab is your DRTLA. This is where any documents, referrals, telephone encounters, labs, and actions live. So once my patient has maybe, for example, a urinalysis added, I would be able to see it listed here. I can see under documents, this is that tobacco smart form that I just did. Your history tab is going to hold your medical history, GYN, OB, etc., all of those histories listed here. And notice on the right-hand side, you have an arrow. So moving forward, when your patient comes back to be seen again, you can always access this information here. Click the arrow one time and it would bring it into your progress note for you. Your CDSS tab, this is where your clinical decision support system lives. So, any alerts that you have in for your patient, so you can see here like depression screening. I didn't do a depression screening for my patient. It's letting me know that it's due, as well as that alcohol screening. Because I didn't complete it, it's still listed here. Once these items have been completed, they will automatically fall off of this list. Your OS is going to stand for order sets. This is a quick way that your providers or you can put in any treatment information for your patient, such as labs or something of that sort. You'd be able to use this order set to then quickly get to them. You also have your templates. If you have any templates added as a favorite, you would be able to see those listed here as well. So once I'm completely done with everything, I'm going to navigate back to my S Jelly Bean, and it's going to take me back to my office visit screen. Notice next to my patient's name, I now have a stethoscope icon letting me know that I have taken the vitals for my patient. I'm now ready to click on my status column and change my status. From here, I can select the appropriate option, such as ready to be seen. That lets my provider know that this patient is in room 6 and they are ready for them. Now, one other thing I want to draw attention to from this window is Test Adrian. Notice this patient's name is highlighted in green. That lets me know that this patient has something that has been ordered for them. From this window, I can select my patient's name and click View Orders, and I would see any of those orders listed here. So in this case, I know this patient had a CBC ordered today. I can also see this from my patient's progress note. So I'm going to click on my patient's name and it's going to take me right into their progress note. Now I can see it listed here under my treatment window, but I can also see it listed down here in the bottom left-hand corner. Notice I have the number 1, and when I hover to discover, it tells me that there's an action required. Once I click on that number 1, I can see that I have one lab. I can click on the arrow and it tells me that I have a lab that has not been sent. Now, if I would have already transmitted this lab, then it would be listed as completed and I would not have that number 1 listed there. This applies to any orders for your patient, such as medications that were not sent, diagnostic imaging, labs, etc. So, a quick way that I can see the status of any orders and what their progress is. That concludes our video. Thank you for joining.